Basic medical sciences, welcome. In this video, we are going to start a journey on articulations between the bones of the lower limb, and we are going to talk about the hip joint. The hip joint is formed by the cup-like acetabulum of the hip bone, right? It's called the acetabular fossa, particularly on the lunate surface, facies lunata. I will show you in a clear picture. Right, so I said it's formed by what? The acetabulum and the head of the femur, right? Caput femoris here. Okay, so you can see on this picture, this is the acetabulum, right? And around here, that's the lunate surface. Here you can see the head of the femur, caput femoris, right? The acetabulum is covered with hyaline cartilage only in the area of the lunate surface. You can see here only the lunate surface is covered with the cartilage, right? The rest of the acetabular fossa is filled with loose fatty tissue, and the base of the ligament of the femoral head, you can see here, that's the ligament of the femoral head and the base of the ligament of the femoral head. So there is a fibrocartilaginous rim. It's called a labrum acetabulare, right? So this labrum is actually attached in the whole edge of the acetabulum and makes a cavity even deeper, right? So you see the depth of the hip joint is more than just a spheroid, right? It's more deeper than the shoulder joint than the glenoid cavity, which makes the movements in the hip joint limited if we compared it to the to the shoulder joint, right? The fibrocartilaginous rim bridges the acetabular notch here and forms the transverse ligament of the acetabulum, ligamentum transversum acetabuli here, right? That's this transverse acetabular ligament. The surface of the femoral head articulating with the acetabulum forms 2/3 of a spheroid. It is covered with hyaline cartilage with the exception of the fovea capitis, giving attachment to the ligament of the head of the femur. You can see here, that's the articular cartilage covering the whole head except the tip here. Let's look at the attachment of the articular capsule. The articular capsule of the hip joint is attached along the whole rim of the acetabulum. In the region of the acetabular notch, it fuses with the transverse ligament of the acetabulum, which I showed you in the previous slide. The articular capsule is attached to the femur in the front along the entire distance of the intertrochanteric line and behind to the femoral neck parallel and medial to the intertrochanteric line. As a result of such attachment line of the capsule on the femur, most of the neck is enclosed, right? So most of the neck of the femur is enclosed in the joint cavity, right? Let's talk about the characteristics of the hip joint. Number one, it's a simple joint, articulatio simplex. Why? Because it has only two articular surfaces. Number two, it's a complex joint. Why? Because the inside there is a fibrocartilaginous rim, that's a labrum acetabulare, which increases the depth of the acetabulum. And number three is a cotyloid joint, right? Because this kind of joint is a ball and socket, but it's so deep to the extent that the movements are limited, right? So therefore it permits movement, though not as free as a free ball and socket joint on three main axes: frontal, sagittal, vertical, and also if you cross from one plane to another, circumduction is also possible. All right, the ligaments of the hip joint are divided into two main groups. They are intra-articular ligaments, that's ligamenta intra-articulare, and extra-articular ligaments, ligamenta extra-articulare, right? So let's start with the intra-articular ligaments, right? First, there is the transverse ligament of the acetabulum, which I mentioned in the previous slides here, right? So this one, it bridges the acetabular notch. Secondly, there is a ligament of the head of the femur, which you can see here, right? Here is cut. That's the ligament of the head of the femur, ligamentum capitis femoris. The base of this ligament is attached to the acetabular notch, you can see here, and to the transverse ligament of the acetabulum. It is an elastic padding which absorbs shocks experienced by the hip joint and transmit the vessels to the femoral head. That is why the head does not necrotize in fracture of the femoral neck if the synovial sheath remains intact, and vice versa. Next, we'll talk about the extra-articular ligaments, right? The extra-articular ligaments of the joint are arranged according with the three main pivotal axes. That's three longitudinal ligaments with a ligamenta iliofemorale, pubofemorale, ischiofemorale, which pass perpendicular to the horizontal axis, that's frontal and sagittal, and one zona orbicularis, which is perpendicular to the vertical axis. Don't worry, I will go through these ligaments one by one, right? But if you can see this on this anterior view, you can see ligamentum iliofemorale. That's the iliofemoral ligament, and you can see here touching the pubis is the pubofemoral ligament, right? That's what you see on the anterior side. All right, so let's talk about these ligaments one by one, starting with the iliofemoral ligament. That's Bettin's ligament, ligamentum iliofemorale, right? So this ligament is seen on the anterior aspect, right? Its apex is attached to the anterior inferior iliac spine, and its widened base is attached to the trochanteric line. It is the strongest ligament in the human body and can withstand a load of 300 kilograms. Right. Next is the pubofemoral ligament here. Right. So this ligament is on the inferomedial aspect of the joint. It stretches from the pubis to the lesser trochanter and blends with the capsule. This ligament resists abduction and checks lateral rotation. The next one is the ischiofemoral ligament, ligamentum ischiofemorale, right? So this ligament begins on the posterior aspect of the joint at the acetabular rim in the region of the ischium. It passes laterally and upwards over the femoral neck. It blends with the capsule and attached to the anterior edge of the greater trochanter. It limits medial rotation of the thigh, and together with the lateral part of Bettin's ligament, it resists abduction. If you look here, we covered ligaments which you can see on the anterior aspect. That's the iliofemoral ligament here and the pubofemoral ligament. Then if you look on the posterior side, that's where you find the ischiofemoral ligament, ligamentum ischiofemorale, right? It's in yellow here. The next ligament is the orbicular zone, zona orbicularis, right? So this ligament consists of circular fibers in the deep layers of the articular capsule, right? So here, if you look here, that's where you see the zona orbicularis, right? So you find this ligament under the longitudinal axis as described above, and these fibers will embrace the femoral neck like a loop and attach above to the bone under the anterior inferior iliac spine. The circular arrangement of the zona orbicularis corresponds to the rotational movements of the thigh. Right, so if you can go through all these features, right? So let's see, this is the articular cartilage which you find here on the acetabulum, right? And this is the articular surface of the head of the femur, and on the tip you can see the ligament of the head of the femur here attaching to the transverse ligament of the acetabulum, right? And in yellow, that's the joint cavity or the synovial cavity, right? And outside, if you look, this secular ligament, the zona orbicularis, the one which you can see here, right? Yeah, so those are the main features which you can see in this section. Let's talk about the movements of the hip joint, right? So number one, there is movement in the frontal axis, thus flexion to the front and extension to the back, right? So flexion is more easily because there is no tension of the fibrous capsule, right? Next movement is in sagittal axis, thus abduction and adduction. So abduction, you remember it is the limb will be drawn to abduct. The limb will be drawn apart laterally, and then adduct, the limb will move towards the midline. The abduction is possible to around 70 to 75 degrees. The third movement is vertical axis. There is a medial rotation called pronation and lateral rotation called supination, right? So if you can see here you can see medial rotation, lateral rotation, right? So this one will be pronation, supination. You can see flexion, extension, and I said flexion is more easily. Here you can see moving like lateral will be abduct, and towards the midline is adduct. Thank you so much. If you like this video, make sure you give it a thumbs up. Don't forget to subscribe. Peace out.